Hi, everyone. Thanks for coming to the Asylum breakout room today. I think we'll wait just 1 or 2 more minutes to make sure everyone's here. I know we're running a bit behind, but make sure everyone who wants to be in this room is able to be here. I'm going to share the PowerPoint. Can you please all let me know if you can see it? Okay, great. Thank you.
Looks great.
Thanks. All right, maybe give it another minute just to see if anyone else comes in. All right, I haven't seen anyone else be added yet. So do you want to get started, Katrin?
Sure, yes, thanks, Melissa.
Okay,
Hey,
great.
everyone. I don't know if we've already done introductions, but I'm Katrin. I'm great. I'm a medical student at UCSF and part of the PHR Asylum and Refugee Committee.
And I'm Melissa. I'm a medical student at Georgetown, and I'm also a member of the Asylum and Refugee Committee. And then I think that's, and there's two other members of the committee who are unable to join us today, Pooja and Maddie, and you may know them because they may be your asylum clinic coordinator. So thank you.
Great. I just wanted to start off by reorienting everyone to the general definition of what asylum is and who are people seeking asylum. And so asylum, by the definition, is the grant by a state of protection on its territory to persons from another state who are fleeing persecution or serious danger in their home country. It's a lot of elements, and there's several different reasons why folks can apply for asylum to seek safety in another place. And so an asylum seeker is somebody who is fleeing persecution or danger in their home country for protection. These folks have claims, and then they're submitted to that country that they're trying to go to, and then the country decides whether to grant asylum to that person, which then will allow them to come live safely in the new country. Not everyone will be recognized as a refugee, but every refugee was initially an asylum seeker, so trying to leave their home country because of various reasons that are actually allowed to be submitted for asylum status. And so how can we help, and where do we fit into this journey of folks seeking asylum? And so on average, 37.5% of asylum seekers are granted asylum or another form of protection in the United States, and medical and legal documentation submitted on their behalf, 89% are successful in their immigration courts. And so as medical professionals, we can contribute to the medical documentation that is submitted on behalf of the asylum seeker to increase their chances of hopefully being granted asylum here in the United States.
Thank you. So there's two kind of ways that we can do evaluations to help support an asylee's claim in the asylum court. So we can either go through the official PHR asylum network or through asylum clinics. So what the network is it's from PHR headquarters, and they're PHR officially trained clinicians nationwide who get these requests through the headquarters, and then they're transferred to the network of people. So there's about 1,700 of them across the country. And then it's done all through the staff of PHR. So it's Elsa and Katrin that you guys may know. And that's a little different from the asylum clinics, because the clinics themselves are associated with a medical school and ran by medical students. And they are more ingrained and kind of permanent in the community. And what they can do is they not only get evaluations from the PHR official network, but they can also get evaluations from lawyers in the community, different organizations such as Catholic Charities. And then they can also help facilitate other things for asylum seekers. So they may help with continuing care, they may help connect them with other free clinics, they may help them connect with other psychiatrists or with other types of affidavits as well. So it may not just be for asylum seeking, it can be for like disability forms and other things like that. So there's kind of two ways that we can get evaluations done, either top down from the network down to individual clinicians, or from the clinics getting these evaluations and assigning them to different clinicians within their own clinic. So here's a little bit about the process of kind of how it all works from start to finish. So there's the recruitment of people who are interested in helping asylum seekers in some way, just getting the word out about what these evaluations are, what we do. And that's usually done on the PHR website or through clinics. So clinics in the area will email out to individual hospitals, to individual clinicians, and basically get the word about these trainings. Trainings can happen both by PHR official clinics, so those affiliated directly with the PHR headquarters, and they can be done by PHR unaffiliated clinics. So these are clinics that have been established at medical schools that the Asylum and Refugee Board helps kind of manage, but they don't get evaluations from PHR headquarters. They just get them from community partners and community lawyers. So the training is done, and then usually we can get cases. So like I said before, the clinics can get cases or PHR headquarters get cases, and they email them out to either the clinic coordinator or they email them out to a clinician in that area of where that client is located. So once that's placed and someone volunteers to help out, they then coordinate between the scheduling coordinator, the lawyer, the client, and the clinician, and potentially the translator. A lot of times we do need translators to help with these evaluations, so that's a huge component of this as well. And then the evaluation is performed, which I'll go in detail in a little bit. And then what happens is after it's completely done, they have to write the evidence to submit to court. So the evidence is this thing called an affidavit, and the affidavit will include all the findings in the evaluation, the entire physical or psychological exam, depending on what type of evaluation is done. And this is often written by the medical student as a first draft, if done through an asylum clinic, or it's written by the clinician and then reviewed over by the lawyers before submitted as evidence to the court. Sometimes clinicians are called to give in-person testimonies, either over the phone or in court, but usually people will know about these testimonials before they write the affidavit or even volunteer. And then once it's submitted to court and you've done all the work, you just kind of have to wait to see the outcome. Oftentimes you won't end up knowing the outcome because it may take years for this to happen. But we really try to encourage the lawyers to submit to us whenever the final outcome is done, either to the clinic themselves or to the PHR official headquarters. So you may not know always the outcome, or you'll find out years later if you're still associated with PHR about what happened. So those are always really rewarding when you kind of get fast turnarounds and you can really see in person the impact you've made for somebody, but that's not always the case, unfortunately. So I want to go a little over more about what trainings are. So trainings basically are mandatory for anyone who wants to do an evaluation. So if there are any healthcare workers, licensed social workers, doctors, physician's assistants who want to take part in doing an evaluation affidavit. They're also for people who are just more interested in asylum and asylum law and want to be advocates in their community. They may not be a clinician, but just to learn more about the work we do. They're also for medical students who want to do evaluations at their medical school's clinic, or someone who's interested in starting a clinic at their own school just to kind of learn about what we do and how these work and how to do an evaluation. So it's kind of an all-day process, kind of like this conference today, but you really need kind of all day to really get to like how we do the evaluations, why we do the evaluations, and how they work. So you spend about 2 hours learning the legal aspects about what you're doing, about how we have a lawyer come and talk about how people apply for asylum, kind of the different like legal jargon that we may not understand as clinicians. And then we have someone explain what evaluations are and how to do them, how to ask the right questions, how to document scars, how to do like the PHQ-9 for psychological eval. And then we have sessions of how to write that affidavit in the correct formatting. And people have gotten kind of creative, especially with the virtual setting now. Like they have breakout sessions on how to write like a good and bad affidavit. And then of note, these all have been virtual this past year. So our clinics have been really good at adapting to the COVID-19 pandemic by turning everything into a virtual format, which has been great because we've actually been able to train more people now that people can do a training anywhere in the country. So you can be in California and you can be listening in on an evaluation or for an all-day training like in New York or something. So that's been really beneficial to training more people this year, especially because before we've had people having to fly out from all over the country to go to the certain trainings that were happening. So going over kind of how the medical evaluation works. So what will happen is once it's scheduled and a clinic spot is reserved and or found, depending on kind of the area you live in, the clinician who's the attending or sometimes a resident, if they're really well trained, will lead the interview and do the full physical exam. So this will include things like asking about the entire client's background, early events of childhood, all the traumatic experiences that led them to need to flee their country in the first place. And often these can be very traumatic and people can have visceral reactions while recounting the story. So these are sometimes done in like 2 to 3 sessions if the story is very traumatic. And people often need to pause and take time to kind of just like let the patient breathe. And we just need to take a lot of time to be able to do this because you don't want to rush exposure of a re-traumatic event like this really suddenly. So after that's recounted, they'll kind of get the story of the journey of how they got to the United States, why they're applying for asylum now. And then they'll do the physical exam. So depending on what the trauma is, if it was like torture, they'll look for any signs of torture on the body. They'll look for any scars. If it's a female FGM, a female genital mutilation case, they'll have to do a pelvic exam, which can be also very sensitive in nature. So these do need a long time. So after all the evidence is gathered in these sessions, depending on how many sessions are needed, they will then write the affidavit, as I mentioned earlier, that the medical student may draft first, and then the clinician will look over, and then the lawyer will look over. And then I wanted to share a few of these stories with you guys. You guys can kind of get a picture of who the clients are if you've never done one of these before, or just kind of the different types of evaluations that we do. Because there's a certain number of grounds for asylum legally. So I wanted to review 4 of these. These are very sensitive cases, however, so just be aware that if you do need to mute or close your Zoom for the next 2 slides, please do so now, because we will be kind of recounting some of these stories. Thank you. So one of the more cases that's been in the news more lately is grounds for asylum for LGBTQ persecution. There's many countries where being LGBTQ is illegal, and in some countries even punishable by death. So I wanted to review this one story of this man in Cameroon who was working with the MSM community, and he was a leading gay rights activist. And then because he was kind of a known figurehead in this community, the government wanted to kind of attack him because he was so outwards, and being gay is illegal in Cameroon. It's not punishable by death, but it's a reason to imprison somebody. So unfortunately for him, he was constantly assaulted and harassed. He was captured and then tortured in prison. And then they were harassing his family quite a lot. So they came to his house to arrest him, and he had to go into hiding. And he was eventually able to escape to the United States and try and get asylum due to these torture events that he endured. Another reason that we often have people seeking asylum is different reasons of sexual assault. But there's also people who've gone over sexual assault and gang violence. So these are kind of 2 separate things that people can do grounds for asylum for, but I kind of wanted to cover this complex story of this one lady. So she was a very young female. She was in her 20s. She was kidnapped by a drug trafficker who was part of gang violence in Honduras. They basically kept her as like a female slave. And during this time, she was raped by many people. She ended up having a child. And then because of this, she had extremely complex PTSD and nightmares. So she was able to apply for grounds of asylum because of all the torture she endured and because of the gang violence. So it was kind of a multifactorial claim for this case. And then there's, oh, sorry, did I go the wrong way? Oh, no, this one. So a lot of times we'll see political grounds for asylum. So people who have gone against the government in many of their countries and then been tortured or brutalized because they were just trying to speak out. So we've seen many times in like Ethiopia and the Democratic Republic of Congo. So this lady, for example, she was working as a peaceful protest and trying to get women more involved in activism. She was then arrested because she was trying to organize people, and in prison, she was unfortunately beaten and raped. She was then able to successfully flee with the help of her other family members to get out of the country. But she does have many scars from this, and they were able to kind of document in the affidavit themselves the scars that she got. And then a lot of times we'll have people who need translators. So she was speaking French. And then when you usually get a case description, it'll say if they need or don't need oral testimony, if they need a translator, and if they are or not in detention at this time. And then another case that's grounds for asylum is something I had mentioned before, is the female genital mutilation. So this is not common, but this is often seen as a grounds for asylum for many people. So this was an interesting case because this was kind of grounds for asylum for two people. It was the mother who had gone through this already and was trying to escape it. And she was trying to help her daughter not go through FGM as well. So it kind of demonstrated like this woman went through it and now has PTSD from it. And she's trying to not have her daughter go through the same thing. So they were fighting on grounds for asylum for FGM for the both of them. All right, Katrin, do you want to take over?
Yeah, thank you so much, Melissa. And, we'll talk a little bit about vicarious trauma and how to process all these intricate histories that you will experience when reading and listening to these folks' stories. We also wanted to give you a little insight on what we've been doing since the COVID pandemic, because the courts were kind of on a halt, and a lot of these cases were not moving as quickly as they were before. And a lot of people were like, what do we do now? Because a lot of these physical evaluations had to happen in person. And so PHR started this campaign to write expert declarations. And it's to help folks who are detained in detention centers across the nation leave and seek more safe shelter, because there were so many outbreaks of COVID-19 in these places, because they're really crowded, people are in tight closed spaces. And so when they launched this campaign, we actually incorporated all the affiliated clinics that we work with, and we encouraged as many folks as possible to help with this campaign. And so lawyers would reach out to clinics in their area and partner with that group and find somebody to write an expert declaration that served in court to help release this person in detention centers. And we had over 15 asylum clinics, student-run asylum clinics, participate in this campaign. And over 50 people have been helped get released from these detention centers and more safely shelter in place elsewhere. And it was more on grounds of the overcrowding, the poor living conditions, and also that a lot of these folks who were in these detention centers have so many other comorbidities that left them in the higher risk categories for worse outcomes if they were to contract COVID. And so that was kind of the grounds that many of these clinicians used to help folks be released, and using a lot of the literature that's also coming out about COVID and its impact on folks with comorbidities. And up at the top right corner, this was a snapshot from the ICE website, and they've been documented how many people are getting tested, how many people are getting infected, and what's going on there. And if you go onto their website, you can actually see breakdown by detention center in your region or state, if you're at all interested in these numbers. And now we just wanted to take a moment to talk about vicarious trauma and self-care. And the official definition of vicarious trauma is the process of change that happens because you care about other people who have been hurt and feel committed and responsible to helping them. Over time, this process can lead to changes in your psychological, physical, and spiritual well being. The reason we always want to talk about this, whether you're starting a new clinic, you're joining the network and you're new, or you've been doing this for many, many years, this process, like the definition mentions, is process that occurs over time, and sometimes we don't even realize that it's happening because it's minor changes that happen, and maybe you wonder, why did I react so negatively to this when maybe before I haven't, or why am I so sad all of a sudden on this random day? And it's things like that that maybe you can't put your finger on it right away, but it's because we're hearing all these stories and processing them at different times, and it takes everyone a different time to process all these traumas that we're hearing about. And ultimately, it's because we want to help all these people, and we want to work with them, and we want the best outcomes for them. We want them to have asylum in this country. And so it's really important to identify when these changes are starting to happen as much as possible. And so I'll just give a couple examples of what vicarious trauma might look like. So, experiencing lingering feelings of anger, sadness, becoming overly involved and emotional with the patient, experiencing bystander guilt, feeling of self-doubt, being super preoccupied with one person's case, thinking about this client outside of the work environment, um, finding yourself losing hope or being more pessimistic than normal for yourself, starting to distance or feelings of numbness, or detachment from your inner circle or your work, and having difficulty maintaining professional boundaries with clients and overexerting yourself. And again, it's all stemming from the fact that we really want what's best for our clients and want to help them. And so we want to share some ways that we can combat vicarious trauma and continue doing this work so that we can ultimately help all our clients. And so one big thing is, just like we are talking about it with you today, we hope that once you leave here, you not only think about it for yourself, but also make it a topic of discussion at your trainings or at your in your clinic environments as much as possible, so that folks are paying attention to it. And remembering to take care of yourself, because in this profession, and it's a long career, taking care of yourself helps you take care of others. And so making sure that you are paying attention to both your psychological and physical health. And these can include things like having reflection and debrief sessions, maintaining a healthy work-life balance as much as possible, being realistic about what you can accomplish. And so maybe not taking on too much on your plate so that you're thinking about these cases at 2 a.m. when you should be getting a little bit of sleep before you're the next day. Taking breaks, like Melissa said, that's really important to identify when folks might be reliving a trauma or experiencing vicarious trauma, and taking a break, and taking a time out, seeking support, whether it's from your family, your social network, your peers, your colleagues, using the buddy system, and again, doing things that you truly care about and value to reset yourself. And then the last thing we want to leave you with is considering switching the narrative of all these traumas that you hear about to resilience, and taking them in as vicarious resilience rather than trauma as much as you possibly can. And this comes with time. These folks have endured so much to get to that place where they are having this evaluation with you and your group. And despite enduring so many traumatic experiences, they've also been very resilient to have made it this far to sitting with you for this evaluation. And so we really encourage you to also think about that fact, that they're there and they're getting this evaluation, and you are a small part in this whole narrative to help them seek the safety and ensure the safety that they're fighting for. And so just always remember to take care of yourself so that you can continue to take care of your clients and patients. And I believe that was our last slide.
Thank you so
And
much, Katrin, for going over vicarious trauma.
Yeah.
Yeah, does anyone have any questions for us or the Asylum and Refugee Committee in general?
Or comments.
Or comments, yeah.
Yeah. Love to chat.
If we do have questions later, I know you have this email here, and I know lots of people are going to watch this video as well. So thank you so much.
Yes, thank you so much, Melissa, Katrin. I am not coming from medical side, I'm coming from legal side. So it's been really an eye-opening for me. So thank you. I will definitely reach out to your contact email. Thanks a lot.
Good. I'm glad. Thank you so much, you guys. We'll stick around on this breakout session for a few more minutes if anyone has questions. Or you can try chat us privately as well if you don't want to ask in front of everyone. So thank you everyone so much.
Thanks everyone for listening.
Thank you.
Thank you for driving the PowerPoint, Melissa.